rheumatoid arthritis? It is an autoimmune disease characterized as a chronic inflammation disorder in the synovium, particularly in small joints. It does not only occur in small joints, but it is most prevalent in small joints. The inflammation results in joint destruction and juxta-articular bone, which is a fracture near the joint. Although rheumatoid arthritis is known for causing painful, inflamed joints, RA can also affect more than joints, including a variety of body systems such as the skin, eyes, lungs, heart, and blood vessels. What is an autoimmune disease? An autoimmune disorder occurs when the body's immune system attacks itself. In RA, the immune system mistakenly attacks the joints or other body systems. The body attacks itself as if it would attack a foreign invader. It produces an immune response to release macrophages and cytokines. Rheumatoid arthritis is typically expressed during the ages of 30 to 50. However, RA can become active at any age. More than 1.3 million Americans have RA and is predominantly diagnosed in females. About 75% of diagnosed individuals affected by RA are females, with an incidence rate of 1 to 3%. Causes of rheumatoid arthritis are multifactorial, which means that it does not have just one main cause. Pleiotropy and production of pro-inflammatory cytokines are the major causes of rheumatoid arthritis. Pleiotropy is when one gene influences one or more phenotypic traits, and the autoimmune production of pro-inflammatory cytokines produces interleukin-1 and tumor necrosis factor alpha. They are the two key pro-inflammatory cytokines involved in active RA. The pathogenesis of rheumatoid arthritis is the activation of the immune system activating macrophage production. Macrophages release pro-inflammatory cytokines. And as we said earlier, the two key pro-inflammatory cytokines in the disease pathology is interleukin-1 and tumor necrosis factor alpha. Cytokines stimulate fibroblasts and chondrocyte and articular cartilage with destructive enzymes. Key destructive enzymes is matrix metalloproteinases 3. MM3 is responsible for bone reabsorption and cartilage destruction. Destructive enzymes cause joint erosion, and synovitis results from the inflammation response, which also leads to further joint erosion. Articular bone erosion represents osteolysis due to an unbalanced homeostasis in osteoblasts and osteoclasts. Specific to rheumatoid arthritis joint destruction, the fibroblasts develop the appearance of transformed cells under the influence of pro-oncogenes during cell cycle. Adhesion molecules facilitate the migration of the transformed cells to the joint as well as the attachment of the synovium to the bone. Eventually, the process will result in synovitis, which will lead to bone erosion in the joint. Articular bone erosion represents osteolysis due to an imbalanced homeostasis of osteoblasts and osteoclasts in localized joints. Severe untreated RA will lead to further joint damage. The severe untreated rheumatoid arthritis will lead to soft tissue swelling, juxta-articular bone, osteoporosis, subchondral erosion, bony ankylosis, joint space narrowing, and subluxation. Other body systems affected by rheumatoid arthritis are the eyes, which can be present in Sjogren's syndrome, which is dry eyes and dry mouth, lungs and interstitial lung disease, heart disease with atherosclerosis, blood vessels with arteriosclerosis, thrombus or embolism can cause deep vein thrombosis, and there's been found a correlation between rheumatoid arthritis and afibrillation, which of course increases the risk for a cerebrovascular event. Rheumatoid arthritis is commonly characterized as chronic inflammation in the joints. However, the disease can attack the immune system of other body systems such as the eyes, lungs, heart, and blood vessels. Secondary Sjogren's syndrome can occur in individuals with pre-existing autoimmune diseases like RA causing dry eyes. Interstitial lung disease can develop as a result of an overactive immune system caused by rheumatoid arthritis. Interstitial lung disease is a group of lung disorders characterized by scarring and inflammation in the interstitial lung tissue. The scarring causes fibrosis of the lung tissue, resulting in a decrease in oxygen perfusion from the lungs to the blood. Because of the amount of inflammation present in the body, RA can double the risk of developing heart disease and atherosclerosis. The damage to the vessel walls with large amounts of cytokine present causes plaque buildup at a faster rate. Inflammation can also cause the rate of developing a deep vein thrombosis due to the amount of inflammation and fibrinogen in the blood. There's also been found to be a correlation of rheumatoid arthritis and afibrillation, which increases the risk of a cerebrovascular event. Signs and symptoms of rheumatoid arthritis are painful, swollen joints due to inflammation in the synovium. Joints may be red and hot. Morning joint stiffness will last beyond the first 5 to 10 minutes after waking. Joint stiffness may worsen after activity. Fatigue, fever, and weight loss are other symptoms present during rheumatoid arthritis. Diagnostic procedures for RA include a variety of blood tests and possibly some imaging procedures such as X-ray, MRI, or ultrasound. An elevation in erythrocyte sedimentation rate and hsCRP, which is C-reactive protein, can only indicate a presence of inflammation in the body. These elevated blood tests are not inclusive to RA, but can indicate a general presence of inflammation. A blood test for rheumatoid factor and anticyclic citrullinated peptide anti-CCP antibody are more specific to rheumatoid arthritis. Imaging procedures such as X-ray, MRI, and ultrasound can also determine rheumatoid arthritis versus osteoarthritis. So the regulation of IL-1 and TNF-alpha cytokines are the primary concern when treating rheumatoid arthritis. Although there is no cure for rheumatoid arthritis, remission may be possible to achieve if the treatments begin early in the disease stage. Some treatments include steroid medication, which is oral corticosteroids, prednisone, or budesonide, which is also known as Entocort. The long-term use of these medications has severe adverse side effects such as osteoporosis, immunosuppression, adrenal insufficiency, and diabetes. So they do want to be used sparingly. Immunomodulators is a type of oral DMARD with the capability of modulating the immune system to decrease the inflammatory response. Oral immunomodulators include Imurin, methotrexate, Plaquenil, azathioprine. So a DMARD is a disease-modifying antirheumatic drug. And all of these medications are considered oral biologic treatments. Anti-TNF or TNF inhibitors is a class of biologic DMARDs. A biologic is administered through the intravenous route or subcutaneous injection. Most of the biologics used to treat RA are administered through IV. Common TNF inhibitors are Humira, Enbrel, Remicade, and Simponi. Biologics are a monoclonal antibody therapy which uses synthetic monoclonal antibodies to attach itself to a specific cell so the immune system can attack that cell. Biologics also have the ability to cause immunosuppression. Although it is not common, surgery can repair damaged joints. Under certain conditions, a physician may decide to perform a acetaectomy, articular repair, arthrodesis, or total joint replacement. So some community resources to help individuals with rheumatoid arthritis are the American College of Rheumatology, the Arthritis Foundation, Arthritis National Research Foundation, the CDC, and many nonprofit or government programs listed here.